We've put together a terrific panel to discuss this version of healthcare reform, particularly the cost. And that's how we're going to try to break this out. We'll talk about cost right now and then coverage and choice a little later. Professor Kenneth Thorpe chairs the Department of Health Policy and Management at Emory University. Professor, good to see you. Thanks for being here. Eamon Javers is a financial correspondent for Politico.com. Eamon, as always, thanks for being here. And Lori Montgomery covers healthcare for the Washington Post. Lori, good to see you as well. Professor Thorpe, let me start with you. First of all, let me establish a bit more of your credentials here. Is it true to say that you've actually had some conversations with the Senate Finance Committee in terms of providing some guidance, some input, as at least to frame out the discussion? Is that correct to say?
Well, I've been asked on a number of occasions from this staff to help them think through some of the technical aspects of the bill. So I've had the opportunity and the pleasure of working with the staff to work out some of the technical fine points of what you see in front of you today.
I say all that to say, you know what's in here. You know what we're talking about here. So let's talk about cost here. Professor, when we talk about cost, let's be clear. What are we going to be paying for here? Are we talking about an expansion of Medicare, Medicaid? You've often told us to think about this as Medicare Plus. So what are we paying for, and how is it paid for in the Baucus plan?
Well, if you have health insurance through your employer today, essentially you'll keep it. So you'll keep what coverage you have today if you currently get it through an employment base. Everybody's been focusing on the exchanges, and if you're an individual, self-employed, a small business, you'd have the opportunity to buy private health insurance coverage, as you just heard Josh talk about, that varies in terms of how much cost sharing you would put out. So the less generous bill, you'd pay about 30%, 35% in terms of deductibles and co-pays, all the way to a more generous private bill plan where you'd pay about 10% of the cost. So it'd be up to your choice to pick whatever private plan you want, or if it lasts, a not-for-profit co-op plan that would offer those same options.
Okay. Eamon, let me have you weigh in on this as well. What are we paying for, and how are we going to get it done?
Well, part of what we're paying for here is the expansion of health care coverage to as many as 30 million Americans who don't have health care insurance right now. That costs money to provide that. And how we're going to do that largely is through fees and taxes that are levied on industry players up and down the system, depending on where they are and where they rank in this bill. And the other way we're going to pay for this, and this is pretty interesting, these so-called young invincibles. I love that term. Yeah. Young people who think that they're invincible, they're never going to get sick, and they say, you know what, forget it. I'm not going to buy health insurance. I'm just going to save the money. Those people will be forced to buy health insurance, whether they like it or not. And if they don't, they're going to have to pay a fine for not having health insurance, much the way we do today with car insurance. You have to have auto insurance to drive a car in case you hit somebody else and need to pay for that guy's bumper when you do some damage. The same principle is going to be applied now to health insurance.
Gotcha. Lori, look, the Finance Committee is trying to bring this bill in at around, what is it, $856 billion over 10 years. The question is, you know, there are shifting numbers as to how many people will be covered by this. Can it be done at this number, $856 billion? What does your analysis tell you about the cost of this, the actual cost?
Well, we don't really know what the actual cost of this is. I mean, this is presumably a forecast from the Congressional Budget Office, which is the arbiter of what these things cost. And they're telling Senate Finance Committee that this thing is going to cost $856 billion over the next 10 years. They're also telling them, so they tell us, that the way they pay for it, which is a mixed savings from Medicare and new taxes and fees on insurance companies and other providers, is going to more than cover the cost. So they're not saying that they have a paid-for plan. They're saying they have a plan that is going to save the government money over the next 10 years and start to reduce these skyrocketing deficits.
I see. Professor Thorpe, let me come back to you, because you've suggested that the cost to really do this effectively is more like $1 trillion, maybe as much as $1.5 trillion, $1.8 trillion. Explain how you come to those numbers.
Well, those are based on earlier drafts from the Finance Committee. They've made several changes in the current proposal that Senator Baucus put out today that basically changed the benefits and changed the federal subsidies. So That did reduce the overall cost of the package down to about $860 billion over the next 10 years. I think the best thing you can say is that we know these are estimates. They're the best attempt from the Congressional Budget Office to get it right. We also know that estimates are always generally wrong.
Yeah.
So the provision the President talked about last week, I think, is really important for the listeners to understand, is that to the extent that the revenues and the savings don't generate enough to fund the program, the President suggested that we put in an automatic trigger that would trigger additional spending cuts to pay for it. So I think that that's a nice reassurance that that he put out there to make sure that this really is paid for.
Okay, Professor Thorpe, thank you. Eamon, thank you. Lori, thank you. We're going to continue this conversation next hour right here in the CNN newsroom with this terrific panel.